Unsafe abortion is one of the leading causes of maternal mortality and morbidity globally. In Nigeria, not less than 1.25 million abortions occur every year. Induced abortion is still prevalent in Nigeria despite its legal restrictions and social unacceptability. It is sad that women who seek induced abortion in Nigeria mostly do so from unqualified personnel, which may eventually result in complications or death. Post-abortion care (PAC) becomes very important in reducing the mortality and morbidity associated with unsafe, incomplete, and spontaneous abortions. In 2017, Ipas Nigeria supported the Federal Ministry of Health in developing and publishing a training manual for post-abortion care in Nigeria. Following this, Ipas has deployed the manual to train over 1,000 healthcare workers of different cadres on the provision of PAC services in several states using the classroom approach for the training. As the training processes went on, the classroom approach became expensive and unsustainable. Additionally, the Nigeria's health sector has been seriously hit with attrition of skilled workers. Therefore, the classroom training approach deprives the already burdened health system of the workforce for 5 to 6 full days. This birthed the on-the-job training (OJT) approach. The OJT is an approach that creates a platform for health workers to learn at the service delivery point, ensuring knowledge, skills transfer, and attitudinal changes necessary to deliver quality healthcare services. In 2021, Ipas designed and implemented the pilot of the OJT approach in 2 states, Gombe and Jigawa, to introduce a better, cost-effective, and efficient approach in improving the capacity of health workforce. Based on the pilot, the process clearly showed that health workers trained through the OJT approach had higher competency scores than those trained in the classroom. Based on the lessons learned from this, Ipas Nigeria supported the Federal Ministry of Health to develop a national training manual for OJT for post-abortion care services in Nigeria and conducted a national pilot of the OJT approach. The post-abortion care OJT national pilot program was carried out in 6 states across the 6 geopolitical zones of Nigeria: Cross River, Ebonyi, Kano, Kwara, Ondo, and Yola, with 119 participants for the classroom training cohort and 112 participants for the OJT approach cohort. Our findings from the national pilot show that the cost savings on the on-the-job training against the classroom approach was up to 50%. More than 70% of the participants considered their personal experience from the training as good, very good, or excellent, while all of them agreed the training was relevant. The average post-test knowledge performance from the healthcare providers trained with the OJT approach was significantly higher than that of classroom-trained providers by 33.6%. However, the providers trained with the OJT approach recorded a higher post-training competency score in medication abortion, but slightly lower scores were recorded in family planning and manual vacuum aspiration competency. These were due to reasons including selection process, monitoring and evaluation processes, and the larger sample size that depleted the resources for the training. It is evident that the OJT approach is economically effective and based on the qualitative responses of healthcare providers. It is more practicable. The on-the-job training is an effective approach to achieve healthcare resilience.